Hi everyone, welcome to lesson 14, the very last one of this entire quarter. Okay, so you made it this far and I'm so proud, I'm so grateful. Okay, this lesson is going to cover the future of health services delivery. Okay, so I just can't believe we made this far and the quarter just went by so quickly, didn't it? Okay. It always goes by really fast. I'm always blown away. Especially with this class, we have so much information to cover and just so little time. So let's get into this. First of all, I just want to say that at this point, normally, I'm actually not going to test too much on Chapter 14, maybe just a couple little things. But for the most part, this is really for your benefit. Okay, so I'm just going to quickly go over some of the main points of the future of health services delivery. Okay, so first of all, the direction of healthcare is governed by, all right, so we got current developments, forces that are external to healthcare delivery. Okay, so our current developments would be some examples, might be the Affordable Care Act, which has triggered a lot of changes going on in the healthcare delivery setting. But there are other current developments as well. Right now, also what is what is going to influence the future direction of healthcare delivery is going to be the forces that are external to healthcare delivery. So a lot of these forces act on healthcare delivery and kind of push it into where it's going, and that's probably the biggest influence of where our healthcare direction usually gets it from. So we're going to go over some of the major forces that are external to healthcare delivery and look at some ways in which a few of these are really influencing the way healthcare is going, and also other influences that healthcare delivery gets is our historical precedents, okay? Our values and beliefs as Americans, where we came from, and we all know where we came from. So, we all know where our healthcare delivery started from and how it developed up until this time because we all watched Chapter 3, right? So we're very familiar with that. What we really want to go through would be a lot of the different forces that are kind of acting on our healthcare system. So let's move forward with that. Here are the 8 forces of future change. Okay, we have social and demographic changes or forces, economic forces, political forces, technological forces, informational forces, ecological forces, global forces, and then our anthrocultural forces. This is more of our anthrocultural beliefs and values, which we're not going to get into because we already know them. Okay, so social and demographic forces. So the United States is actually becoming bigger, older, and more ethnically diverse. Okay, and since it's becoming more ethnically diverse, we're going to have a lot more different needs. Okay, this is going to affect the needs of healthcare and how these needs are going to be met in the future, especially. Okay, so the nation's ability to afford healthcare and keeping up with the growing populations of the older adults and of course the diversity that we are experiencing, and those who are disabled and who are Medicaid beneficiaries. Okay, so keeping up with this, it may be unsustainable in the future financially. Okay, if we don't kind of figure something out, if we don't find another way, if we don't reform what we're doing, if we go on the same path, it may be unsustainable. Okay. We may not have enough health professionals, we may not have enough resources, and so on and so forth. We're going to have a lot of different cultural factors that will create a lot of ongoing challenges in our healthcare delivery system. Since we are becoming more ethnically diverse, we cannot always be doing things the way we used to do. We have to kind of change and fit the needs of our people. So if our people are changing, then we need to go, healthcare needs to change along with them and to fit the needs of them. So also same thing, we have uninsured illegal immigrants. So they also need healthcare resources as well. So we need to take all that into consideration. And so economic forces that we should be mindful of. First of all, we have our national debt. We already know where our nation is in debt, like a lot of debt. So we definitely, we're probably going to have to watch out for maybe tax increases in the future. Also, we need to hopefully be able to grow our economy, because growth in the economy is definitely needed to take care of a lot of that debt. We also have been experiencing a lot of slow economic growth as well. So a lot of people depend on the government and handouts and things like that. So it's not going to be very sustainable in the future, especially the way healthcare is moving. And given this huge debt that we have, it's really taking its toll on. So we have kind of like a negative economic force acting on the healthcare system. Okay. Also, a lot of employment and household incomes have fallen. And if you've looked over the years, like inflation has been increasing, right? We have more inflation. A lot of like the price of food and fuel and goods and housing and everything like that, the prices have gone up, but our incomes have not increased along with all of that. So it's creating a huge problem. Okay. So let's move forward. Then we have political forces and technology. So Americans, political force-wise, Americans here in this country, we're pretty divided. We're almost 50-50, Republican, Democratic, and like we both have like opposite, usually each side will have like an opposite extreme on, you know, some form, some idea or whatever. So then we'll, so right now, we're kind of in this reform stage. We have an election coming up, and in the previous presidency, we had the whole ACA that was just implemented, and then we had a new president who kind of said we're going to get rid of everything that the last president did. And then things are just kind of like, I don't know. But we are experiencing some level of reform, and we kind of will have to see what goes on with the new election to see exactly where we are going politically and how that is going to influence the healthcare system. Are we going to go, because I know there's a lot of talk about, and I'm sure you guys have noticed as well, there is a lot of talk about Medicare for all and things like that, right? Having a single payer system, going from where we are now to a single payer system, and so I'm not sure if that's going to happen anytime in the near future, but we'll have to see what happens with the next election to see exactly which direction we may be moving in the future with healthcare. And so technology. Technology will obviously continue to grow. We are always going to be investing in technology. Technology is always going to be super expensive. And so we are going to experience a lot of challenges as we move forward with technology in healthcare, but what we're going to see a lot in healthcare, especially given the fact that we have a lot of people that are going to need a lot of healthcare, and then we do not have all the health professionals that we do need to sustain the health of all these individuals who are going into retirement and things like that. So we're going to see that a lot of technology that they're going to come out with is going to be based on like self-reliance, also cost efficiency and things like that. So that's where the focus is going to go, most likely in healthcare. Okay, like the type of technologies that will allow people to recover faster and allow people to be more independent with their health and not have to rely on people. Okay, so next we have informational forces. So we have barely just tapped into the potential of information technology, especially in healthcare. Right now, we see information technology and it's going in it's going in a new direction now. We're seeing a lot of telehealth and telemedicine starting to come out, especially right now. So it's kind of exciting. I think we just barely scraped the tip of the iceberg with information technology in healthcare, and we're going to see a lot more developments in the coming future. Then we have ecological forces. So there are so we have a lot of major implications for public health here, especially right now, because what's going on right now, we have the whole coronavirus thing happening. So we have new diseases that come out quite often, especially now, this one pandemic that is really going out of control at the moment. And then there are natural disasters and bioterrorism, so there are a lot of things that we need to be mindful of, especially in the future as we move forward in healthcare. And there may be more bioterrorism, there may be new diseases that spring up, and we need to be able to find ways for us to better handle them more efficiently. Okay, like with this pandemic that we're experiencing right now, we weren't necessarily prepared for something this huge to happen. So, okay, global forces. So globalization intensifies cross-national, cultural, economic, political, social, and technological interactions. Okay, health and healthcare will be affected in diverse ways through multiple different pathways. Okay. So, for example, we continuously experience like brain gains, and as Americans and being part of a developed nation, many health professionals in a lot of developed countries might want to come here and work here. So when that happens, we experience a brain gain. Many times also, when that happens, those countries, those developing countries that they came from, they're experiencing the brain drain. Okay, so they're losing health professionals, we're gaining health professionals. That's going to happen a lot in globalization, and we're going to just see more and more things like that happening. In addition, we do have a lot of health professionals from developed countries deciding that we want to go and help in other nations. We also have a lot of cross-border telemedicine, so many people in other countries and whatnot can receive health care from a health practitioner remotely. So they don't necessarily have to be there in the same room, and that's providing access to health care to not just people and expanding it for people in our country, but also the world. So that's pretty profound. It's a big deal. And there are many, many other different ways we are doing business in healthcare in other countries, and other countries are doing it here in ours. Okay, so we're going to see a lot more of that as we move forward. And then here are our anthrocultural factors, our beliefs and values, the ethos and traditions espoused primarily by the middle-class Americans. Okay, so this is collectively mostly middle-class American ideology. So historically, these have acted as strong deterrent to radical changes in healthcare, because we are kind of the masses, the middle class. So really, what the middle class, what needs that the middle class has, and where the middle class is the middle class holds a lot of influence on healthcare in the United States. So, that's pretty much why health insurance was invented. That's, why a lot of things happen, and why a lot of things went in the direction that they went. And a lot of that was just due to the middle class Americans. So I hope this last lesson was interesting. And I know I didn't take up too much of your time. This was a quick one. Please just go ahead and study. I hope this I hope you guys learned a lot, but if anyone has any kind of questions or anything like that, please let me know, leave a comment, email me, and study well, do your study guides, take your vitamins, eat well, exercise, and you're going to do really well on your final exam. Don't stress.